Hi, Dr. Anthony Giacalone here with Atlantic Coast Chiropractic, bringing you today's Time to Think. How's your spinal hygiene? I bet that's something most of you never thought about, spinal hygiene. I'm getting ready to go in for my biannual dental appointment to get my cleaning done, and it got me thinking, how do we do taking care of our spines and our joints? How do we maintain them? I talk a lot about this in my office because obviously people come to me with pain and issues. The question lies is most of us think when we get an injury or when there's a problem, what did we do wrong? Did I sleep wrong? Did I lift something wrong? Many times it's nothing we did, it's what we didn't do. And here's what I mean by that. I just looked up from the Medical Dental Association, the ADA, that the average person spends about 2 to 3 minutes in the morning brushing their teeth, 2 to 3 minutes in the evening brushing their teeth, and about twice a week flossing. Now, if you didn't brush your teeth for 2 weeks and a month later you had a cavity and had pain in your tooth, would you go to the dentist and ask, why do I have this cavity? No, you would know. I didn't brush my teeth properly and decay came into that tooth and we had an issue. Well, it's the same thing when people come into my office many times. Well, what did I do wrong? And something I'll ask is, well, hey, when's the last time you worked on your movement? When was the last time you stretched your shoulder muscles and your neck? When was the last time you foam rolled? When was the last time you did anything for your muscular skeletal system? Right? The crazy thing is when you think about it, we only use our teeth when we're eating or drinking. Right? Think about how often we use our skeletal system, our muscular system. We use our spine every second of the day that we're not sleeping. And we're going to think that not doing any maintenance on our spine is going to be okay and we're not going to have arthritis in the future. Something else I hate that I see is so many of my baby boomers that come in and, they start having arthritis and, oh, well, that's a normal part of life. No, that's not a normal part of life. If we're taking care of our spine properly, we can live. I see people in their 80s and even their 90s that don't have spinal decay and arthritis. So I want us to think today about, what am I doing to take care of my body from a structural standpoint? Very simple. A couple things we can do. Number one, we need to stretch. Now, I don't want to get into right now about what's the best way to do it. There's dynamic stretching, there's foam rolling, there's static stretching, and a lot of studies are out on the verdict of which ones is the best. The bottom line is do something, okay? The one thing that's conclusive from most studies is that the people that do something to work on their mobility daily have increased range of motion and better movement in their joints. Something I want to go over with you guys a little bit here is a little physiology. And basically, our body has something called synovial fluid. And what that is it's fluid that goes between our joints to help keep them mobile. I call it the WD-40 of the body. You might be familiar with supplements like Triflex and Biflex, glucosamine, chondroitin, MSM. These things are basically supplements that help produce synovial fluid in the body. The problem lies is it doesn't matter how much synovial fluid we have in the body if we're not moving our joints and our muscular system to allow that fluid to get into the joints, help oxygen be produced, help metabolites get into the joints and flush out basically toxins that are going through our body. Best way for me to describe this is almost all of us have used WD-40 before, right? We have that rusty hinge. We spray some WD-40 on the joint, and then what do? Do we let it sit there? No, of course not. What do? We work that hinge. We open and close that door, and slowly but surely that creaking sound and that rusting sound goes away. Well, why is that happening? The WD-40 is penetrating that joint and lubricating it so now that it can glide and smooth properly. This works exactly the same way with our body. As you're moving a joint, you're flushing blood and you're flushing the synovial fluid into the joints to help keep it healthy, help keep the spaces in the joints so that we don't get those bone-on-bone arthritis issues going on here. So by just moving, we're going to be helping prevent arthritis in our spine. So it's vitally important that we move throughout the day, but I find we need to have a spinal hygiene routine. Okay, the best way to do that is schedule a time in. And so we wake up in the morning, we don't even think about it, right? We go right to the bathroom, we start our dental routine after we've put on that pot of coffee, right? So you need to schedule those times, and I recommend first thing in the morning and the evening. All right, in general for stretching, all right, spend 20 seconds stretching a muscle and doing it 2 or 3 times. You can Google different stretches, you can talk to a trainer, you can email me. There's many different things you can do. You can foam roll, but the bottom line is after watching this today, I want you to think about, hey, how can I take care of my spine and how can I implement a spinal hygiene routine? And the best way to do that is just do something to make your joints and your muscles move to improve range of motion, improve flexibility. I don't care if it's just waking up in the morning and turning your neck left and right 15 times. That's going to make a difference. In the future, I will be going over some things that we can do to improve our mobility, but for right now, schedule a couple of minutes a day. Work on your spinal hygiene and you prevent arthritis. Okay. Number two, when's the last time you've gotten checked up and gotten evaluated for your range of motion and flexibility? Have you gone for your chiropractic exam to make sure that those joints are moving properly? One of the big things that chiropractors do, aside from helping decrease pain and improve function, is making sure that that spine is moving properly. There's something called subluxation degeneration. And what that is when a joint is not moving properly, that synovial fluid I talked about can't penetrate the joint. As time goes on, cartilage and discs start to shrink, bone spurs start to form, and we start getting arthritis. So it is important that you are getting your checkups, just like I'm going in a minute here to go get my cleaning and making sure I don't have any cavities before it starts hitting a nerve root and I need that bad root canal. Don't wait till you're 62 and you have bone-on-bone stenosis and arthritis and you have to go for surgery. Go get your checkups, make sure your spine is moving properly so that you can have that good quality life you want to have. There's your time to think for your day. I'm Dr. Anthony Giacalone.